Joining us now from Washington is Republican National Committee Chairman Michael Steele. Mr. Steele, good morning.
Hey, good morning, Harry.
A lot of conservatives around the country feel like the public option, which is still very much on the table and the president is going to talk about tonight, is socialism. Do you think the public option is socialism?
Yes, I do. And quite frankly, I think a lot more people believing that there's more to this than meets the eye. And the reality of it is, you know, I just don't understand this idea that somehow people think that the federal government can enter into a marketplace and compete with private industry. That goes counter to everything that we know about how markets work and the role that the government plays in those markets. So the idea that you're going to take an institution like, you know, Department of Health and Human Services and put them in competition with private insurers, to me, doesn't make sense. If you have an insurance problem with one insurance company dominating a particular market, then break that up. There are incentives and disincentives that can be created that would create greater competition. But the idea that the federal government can come in and all of a sudden be the same as Allstate in providing insurance is a ridiculous notion. And that's the problem here. Right. The people of this country have figured this out, and they're like, you know, this plan makes no sense. And after 26 speeches and 12 resets on this health care plan, tonight, in my view, is just one more opportunity to tell us what we already know.
Okay, except polls would say the opposite of that. Here's the question, though.
No, the polls don't, Harry. I don't know I don't know what polls you're looking at. The polls don't say the opposite of that.
The polls say they don't really know what is in this health care plan or what the public option is.
Exactly, and what they do know, they don't like, which is why this thing has been tanking for the last 3 weeks. That's
all right,
my
let me
point.
ask you this. If the public option is socialism, then what is Medicare?
Medicare is a government-run program that
people
doing
overwhelmingly think works pretty well for them.
No, Harry, come on. How often do we have to do another reset on Medicare because it's in default or running out of money? I mean, the reality of it is, you know, this is something that took a year and a half to put in place.
I don't want this public option, but don't mess with my Medicare. You know that.
Yeah, I know that. And that's now a part of the system here. My only point is, why do we have to upend 1/6 of our nation's economy to fix what the president has now redefined?
Because that 1/6 of our economy left to go as it is will bankrupt us. That has redefined 1/6 of our economy to fix what he has redefined as a insurance problem. If this is a matter of getting a certain number of people insurance, then let's work to get them into the insurance market. There are ways to do that. You can create a situation with respect to pre-existing conditions, address that issue through portability. You don't have to upend the entire system. To do this comprehensively just is not the way this should be done, in my view, and in view of a lot of people. All right. Mr. Steele, as always, a pleasure to chat with you this morning. Thanks. All right.